Hi, good evening, Brahimando.
Hello, good evening, Sister Blessing.
I'm grateful to have you once again in my Zoom meeting. Uh,
Yeah, it's a pretty,
Today I want us to talk about the nervous system disease and disorder. I believe you know what nervous system is.
yeah, sure.
Even if you don't know, at least you used to hear about it.
Mm-hmm.
Okay, now the general terms for nervous system is what we have right now in the screen. I believe you can see it.
Yeah,
That's the brain, the organ that performs number of life-sustaining tasks. It controls the heart rate, respiration, blood pressure, body temperature, process formation from the cells, produce and release hormones. So the nervous system perform a lot of work, but I would love us to also, know about common symptoms of nervous system disease and disorder. The symptoms you will feel, what you will feel that will let you know that you are having nervous system disorder. You can see the headache, weakness, disease, nausea and vomiting, motor disturbance, stiff neck or back. You can't turn your neck, seizure, confusions or paralysis, mood swing, fever, and pain. So those are the symptoms of nervous system. But without taking much of your time, I have three um case study I want us to discuss and learn more about. So I'll read this case study. The first case study says a 2-month-old baby was seen in the clinic with the symptom of vomiting, difficulty feeding, seizure, and irritability. And this has been happening since 5 days now, and the parents are worried. So they took the boy to the hospital for checkup, for medical checkup. And it was discovered that the boy has what we call, you can see the screen, right?
yeah.
Abusive head trauma. Have you heard of it?
Abusive head trauma. Yes.
Yes. So abusive head trauma is a situation where a baby is shaken like an infant.
Mm-hmm.
Maybe the guardians is hungry and shake the baby out of hunger. This is a disease. It can cause a disease to the child. That's why medically or in the hospital after giving birth, some nurses or the obstetricians will advise you not to do what, to shake a baby or to even throw a baby up. Why? Because their brain is not balanced yet. It's still developing. So as you can see, he say when a child is vigorously shaken by the arms, leg, chest, or shoulders, that results in subdural hematoma. This is subdural hematoma is a serious tumor. Okay, and this can lead to bleeding in the brain, which will result in surgery. So to avoid all these things, when you have a child or you even see somebody doing this, you can caution the person, what you are doing to this baby is not good. Don't shake a child, especially the newborn. You don't shake them. So you can see the treatment plan. They say it can result as can be a medical emergency immediately. Treatment is important to prevent further damage, because if this is not done, it might result in something else. Like you can see here, seizure, epilepsy, and paralysis, which is very, very bad. Maybe this has been happening, but a lot of people don't know that this is as a result of shaking a baby or throwing them up,
Mm-hmm.
that this can result in a child being epileptic. or a child
Okay.
having a seizure. So I don't know if you have any question.
No, there's no question. This one is very clear.
All right, thank you. So we move to the second case study, and it says a 50-year-old woman was seen in the emergency with a complaint of facial weakness and drooping mouth and headache. This has happened for a month now, and she could not visit the hospital because of financial issue. Can you guess the diagnosis?
Yeah.
Oh yeah, can I hear from you?
Is it Bell's palsy?
Well, I don't know if you have somebody around you that has this kind of illness, nervous system disease.
No, I don't think so.
Okay, but me, I used to see one woman in the church, though I don't know whether this is the disease she's suffering from. Like one of the face is dropping, and she doesn't wear eyeglass normally. I don't know if this is what she's suffering from. So you can see that the signs and symptoms of Bell's palsy is facial weakness and dropping mouth, withdrawing saliva, sense of taste may be disrupted, headache may persist.
Okay.
So this is disorder of the craniofacial nerve causing paralysis of the muscle on one side of the face. So it weakened the muscle on one side of the face. That makes the face to drop. So you can see the diagnosis procedure, clinical picture of sudden unexplained onset of facial paralysis. And the treatment plan, please can you take the reading, the treatment plan, the treatment.
Okay. It says antiviral medication and anti-inflammatory drugs affected portion of the face must be protected from trauma, wind, or temperature extremes. Electrical stimulation, massage, warm must heat, analgesia, corticosteroids.
Okay, thank you very much. So these are the treatments that will be given to a patient suffering from Bell palsy. Okay, and if this disease is arrested on time, it might help the person. Okay, because as it stands now, there's no prevention for it. Okay, it doesn't has any prevention. But Emmanuel, I don't know if you have any question or any contribution.
Now, on this part, I don't have any question.
All right. So the third case study, I'm reading. Okay, you can see the picture, right?
Yeah,
You see the picture of the Bell palsy, how it look like.
yeah. Mm-hmm.
So I can easily detect somebody that is suffering from this particular disease.
Okay.
And the last case study says a 30-year-old man was seen in an office today with a complaint of muscle weakness, numbness, total loss of vision, and mood swing since a week now, and he needs help as soon as possible. Can you guess the diagnosis? Any idea?
Okay, on this case,
Is
you
it
say it was found with what?
muscle weakness, numbness, and total loss of vision and mood swing?
Okay, that should be Pakistan disease.
It's not. It is called multiple sclerosis.
Okay.
You can see it here. That's what we call multiple sclerosis. It's a chronic autoimmune progressive and irreversible disease characterized by destruction of the lipid and protein layer. So you can see the symptoms of it. It's an immune disorder, okay, and it can cause destruction, okay. So now you can see the signs and symptoms of it: sudden and transient motor and sensory disturbance, impair or total loss of vision, okay. It can cause blindness or partial blindness, muscle weakness, paralysis. It has caused a lot of things, okay. So the diagnosis procedure: no definite tests, rule out other possibility, neurological examination and other analysis, cranial CT scan and MRIS scan will be conducted, okay. And you can see that early treatment is essential, because if you leave it untreated, or maybe you ignore the symptoms you are having, it might cause serious problem, can result to other things that you wouldn't want to put yourself into. Medication to reduce the number of exacerbations of the disease and slow progression of physical disability. Symptomatic treatment includes medical, rehabilitative, and psychological approach, okay. And at the stance now, there is no prevention for this particular disease. Let's check the pictures and see how it can affect. As you can see, it affects
Okay.
almost all parts of the body, and it starts from the brain through the spinal cord. So when you are experiencing such symptoms, it's good to report to the hospital as soon as possible, so that the disease can be arrested on time. So, Brother Mando, I don't know if you have any question or anything
No,
would.
there's no question.
Okay. So those are the three nervous system disease and disorder I choose to talk about. Meanwhile, we have other diseases and disorder, which you can see: Parkinson disease, Alzheimer disease, a lot of them. Epilepsy is also a nervous system disorder.
Yes.
So all of these things is good to learn about it, so that when it happens, or maybe you see somebody suffering from a particular disease, you'll be able to detect, oh, this is what this person is suffering from, and this is how to help the person. So, remember, I believe that what we've learned today, that we will practicalize it and try and learn more about other diseases that we've not been able to talk about today. Thank you so much for giving me your time to share this with you.
All right. Thank you too for sharing
All right.
with me as well. I've been able to learn.
Thank you so much. See you next week.
All right. Bye.
Bye.